So, at the outset, let me thank the organizers for making this possible. Um, Multiple sclerosis has been my topic of study from many years, and at the outset, I would also like to thank Government of India for deputing me here to spread Ayurveda and yoga, and University of Latvia for having me here. So today I will be sharing my experiences on management of multiple sclerosis. So why multiple sclerosis is to be discussed here and now is because it has become a very common phenomena even in India in last 10 years. Before that, it was not very common in India. But today, when you see the global situation, multiple sclerosis is very common. Even here in Latvia, I did find many cases, and I had the privilege of treating them successfully. So let us see who discovered it and who rediscovered it. I will be giving a brief description of multiple sclerosis and what it is in Ayurveda, how it was described in Ayurveda, symptoms of pranavruta vyanavad, avrutavadya vyadi, then comparison of both, then understanding vata, vata vyadi, avarana, avruta, which might be in a very small way, and then management, case reports, complications, long run if neglected. So this is the map showing the multiple sclerosis that is very much prevalent in these countries. And if you will see, it is far away from the uh, equator. The countries, what we in Ayurveda call the Vata Bhuvishta Pradesha. These countries which are very cold, uh, they you can see how it is managed. The color combination will tell you where it is very common and where it is very uncommon, and India comes there. So it would have been assumed that it was not present at all. It was not known to Ayurveda at all. So we will go into that. This is the first case. Initially, we started treating these type of cases when I was working with Maharishi Vedic University 20 years ago. That was when I first heard about multiple sclerosis and saw one case. But then I started thinking if Charaka knew it and if he has described it, because in Siddhistana he says, whatever is known, whatever is presented here is good, best, and if it is not presented here, then it will not be presented anywhere. I thought it was very egoistic. It was too much of a confidence. But then I bowed down my head saying, yes, Charaka has said everything. So when I go into, this was one case. I will about this. I will tell you again. This on 29th November in 1825. Uh, Father of modern neurology, a French neurologist, has been given the credit that he described first multiple sclerosis, Jean Charcot. But then when we see who did it, you will see Charaka, who has described, but we don't even know his details. Like we are not very historical, like remembering the names and all that, and we have not been patenting everything. Charaka and Ayurveda as such gives credit to everybody, the Rishi Munis, which Rishi intelligence. So this is one more case. This have come in between. I will tell you about this. I will come back to this slide again. So when we go into the division understanding of uh, Pranavrutabhaya, Vata, Vibhaga Swabhava Karma Vriddhi. This is the words that we find in Charaka Samhita. The Chala Ruksha Lagu Parusha Kara Vata Guna increases inside the circle and it starts encircling each other. So Shabda and Sparsha Guna Tanmatra of Vriddhi Asti Dhatu Kshaya. So we find that is what is the Sarvendriyanam nayanam, Sarvendriyanam shunyatvam vyane pranavite lingam karma jatro urdhva jatrogatam. So indriyas, all the indriyas, that 5 plus 1 indriyas, all get involved, and all the symptoms that we find, like visual impairments, tingling, numbness, intestinal and system disorders, decreased hearing, sexual issues, spastic memory impairment, everything, you name something and it is there. So all this have been described in two simple sentences. When we find the Avrutavatas, we find that every single symptom of multiple sclerosis has been described here. So, this is basically about how Ayurveda describes it. When we started Ayurveda management, each case is very different. I was very happy listening to the previous speaker, who has been speaking about epigenetics and genetics and all that. We in Ayurveda have been talking about this many centuries ago. And now, since 10 years, maybe, WHO has started with whole person medicine, precision medicine, predictive medicine, personalized medicine, all these words which are very common, which are very well known in Ayurveda, which has been the hallmark of Ayurveda, which has been, we don't give lot of statistics saying we treated so many thousands and we got so much results and this is the statistics. But each statistics that we find in Ayurveda itself is a research that has been done. So what we did was every case would come with MRI, and all symptoms would be recorded. They would be very careful analysis would be done, and then we would start them with management. And Bhrugu Rasayana, this is the described treatment. Desha Satya, Agni, Koshta, every factor was identified, and treatment would be holistic management was always advised. Then what we found at the end of each case was we saw that there were no repetitions and no fresh lesions, and MRI showed no. Every case we got almost like no symptoms and no new lesions and no regression, no exacerbation. So it was very promising. Not that every case we got same results. Patients who had who did not get results were also I have recorded. This is actually demyelination. What demyelination has been told in Ayurveda, and what Avrutavata is, and see, this is the Vata Vriddhi and Dhatukshaya. This is the thing that you find in every case that you find in multiple sclerosis, and this has been told by Chakrapani that this is what happens. What is Palakam? What is Avrutam? What is Kruchrata? What is this that happens? Everything. So Charaka and Chakrapani both have given wonderful results. So Shunyata here, Sarvendriya Shunyata. Sorry. The brain related spinal column crippled or loss of function. So everything that has been told is very well recorded in Ayurveda. Mastakado. So every word in Ayurveda needs to be understood. The students have to follow every case and not say that it is the medicine of the millennium, not just this millennium, for the future also. So uh, we have it recorded here. Pranavruta Vyana Vatavyadi. So organs failure, disturbed memory, all this, everything has been seen. This is how every thing is done. Sorry. Degenerative is the this is the allopathic words, and this is from the classical Ayurveda textbooks. Sorry. Dhatu Karshana, Snehadi Gunashunya is the demyelination that we find. Then autoimmune, progressive, chronic, these are the words which are not coined words, which are there in the classical textbooks. So, Bahuvida Lakshana, Punarayati Prashamayati, relapses and remissions have been very well recorded. Everything has been recorded in this two lines of Charaka Samhita. The whole of Vatavyadi itself is such an interesting neurological condition, neurological uh, cases that have been recorded. See, these are the cases that we have been doing and we have got very good results. This was a 19-year-old boy when he came to us, and he is still with us. He's very healthy. He comes for something else or for his parents or for somebody. So he had optic neuritis when it started. So he started coming, and then this is the impression that was there. So these are some of the things that happen, how each and every organ gets involved. Optic neuritis, diplopia, because I basically check a lot of Shalakya cases. Mm, Most of the multiple sclerosis cases do come to me first because of optic neuritis. And then this is the case that we had much better results. If you will see MRI and brain contrast, we have seen no acute. In fact, it was then we didn't have any uh, new lesions. So most of the cases which are still under my care are uh, getting treatment, but we have a lot of cases which I have been trying to put as case studies for publication, and it is under publication now. So here, and the thing is, every youngster, like from 20 to 30 years, and after 40 years also, they have come to me. So these are the cases wherein we have got very promising results. Promising in the senses, no relapses, no symptoms. Then the patient is very happy because the lesions are resolved. We don't get those cases again. When patients are very happy, they refer other cases to us. So these are every case MRI is done before treatment and after treatment, and we see that even in Latvia, I have got before and after cases, but everything in Latvia is in Latvian language. Still, I do have them. So if you want, you can see each case and check what results we have got. So what happens was, it is a Urdhva what treatment we have been doing. Urdhva Jatru Rasayana treatment as similar to that of Timira, prevents remission, Vatahara Upakrama Shamana, repair pathology of demyelination, Avrita Vatahara lifestyle, yoga, pranayama, the Ashtanga yoga, more of meditation is also, counseling is done. We believe that every individual is unique and every individual is to be treated. So it becomes autoimmunity is like you yourselves don't believe in you. So you have to treat your manas, because Navadravyas, we speak about the Panchamahabhuta, Atma Kala Dik Manas. So all that is going to be treated. There in Charaka Samhita, you also have this. It should have Guru Kripa, Dhanvantari Kripa, Acharya Rasayana, and a Pranabhisara Vaidya. Then management is possible. Charaka also doesn't say everything can be cured. So these are some references that I have put in Ayurveda, wherein it is very similar to what has been referred to today. I have shown 4 or 5 cases only, but we have been treating a lot of cases. So no disease activity and no regression. Regression is total. So patient is very happy, and with no symptoms, parents are also happy. Doctor is also happy. So we get more cases. So compared to previous imaging, there is no disease activity. So these are very promising results that we are getting. But unfortunately, they are all in very young age. So it is very important that they come to Ayurveda. This is the way we have understood how Vata differs in each case and how Avarana takes place. Complications have also been recorded in Ayurveda. Charaka Samhita records that cardiovascular, respiratory systems, skin afflictions, all this can happen if treatment is not done properly and if it is not managed well in time. Most of the cases that we get have already got allopathic medication management, and when they fail, they do come to us. So each person is so unique that management is also very unique. So uh, I would always say Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha, because we believe that one world family, we believe that everybody should be healthy, happy, not just human beings, the whole world, the environment. Um, so if you have questions, I'm open for it, or you can also send me mails. I put my mail ID initially. Here is my mail ID. If you want, you can mail me. I would be very happy to uh, respond to you. And if you have questions, please do ask.